There are no non-responders to structured exercise training, even in older age. And what I mean by that is you will be getting some health benefit, whether you can see it or not. It's there.
Is there any evidence out there, or even in your experience, have you seen anything that is helpful to keep people motivated and sustained in their exercise plans?
Yeah, really good question. And going into the exercise training with a goal in mind. So if you are a new resistance strength exerciser, having a key goal and objective is really key. And then if you and once you achieve the goal, it's about continually moving that and progressing it. So it could be starting. You want to be able to rise from a chair independently. It could be that you want to be able to carry the extra shopping back from the store, half a mile away. Yeah, so it's about achieving that and then moving forward. Always having progressive goals. Another thing we found helps keep people motivated and compliant beyond the initial 2 or 3 months, which is really that critical point where people tend to drop out and lose these habits, is to sort of reiterate the health benefits of resistance. Well, all exercise really, but when we're talking about resistance strength exercise, I guess right now. So I always come back to the point that there are no non-responders to structured exercise training, even in older age. And what I mean by that is you will be getting some health benefit, whether you can see it or not. It's there. An issue can be people starting a training program. Perhaps they're lifting weights and maybe they've changed their dietary habits as well, but they're not noticing changes in the mirror, or maybe they can't fit into the pair of trousers they want to. Perhaps body fat isn't declining at a rate they'd like to see. Perhaps they don't feel an awful lot stronger as quickly as they'd like to see. Some of those benefits may come further down the line, but there are many, many hidden benefits to structured exercise training you can't see on the scales or when you look in the mirror. So, in terms of the associations with disease risk reduction, is profound. If you are somebody who is able to achieve the physical activity guidelines, incorporate some structured aerobic and resistance strength exercise, your risk of these non-communicable disease conditions should be lowered. Um, and not only that, but as I mentioned before, if you are unfortunate to find yourself with, a chronic health condition, your outcomes are greatly improved if you are somebody who is able to achieve these structured aerobic and resistance exercise. So there are many, many hidden health benefits. These tissues, your exercised muscle tissue and other organs in the body are communicating and talking to one another, and there's a health benefit there. Your liver, your heart, all of these, your brain, these things are better protected if you are doing these exercises. And it's difficult. You can't visualize and see these tissues, so you can't see those benefits. But they are there. So I always encourage and remind people of that, even if some of those very apparent visual things aren't changing and improving at a rate you'd expect, or that maybe your friend is experiencing, don't give up, because the health benefits are certainly there somewhere. And of course, our perspective changes over time as well. I think a lot of people exercise in their 20s. It can be for an aesthetic or a performance purpose, whereas in older age, it's less about aesthetics. It's a little bit more about being able to play with the grandkids as they age, being able to remain independent, and avoid some of the health harms of older age and disease risks. Things like Alzheimer's and dementia, huge, are always top of people's list of things they want to avoid in older age. Immobility, institutionalization, care. People are desperate to avoid these things and have a life that's kind of full of vitality, socially active as well. These things are really important. So if you are somebody who is doing structured exercise, all of those things are possible. So keep going.